know your notes today. You're going to be learning a lot of great information. So I'm going to keep this pretty informal. You can ask any quick questions that you have, but I'm going to have lots of time at the end for some questions if you want to chat with me, okay? So let's get started here. Alright, so this is just a quick roadmap of where we are headed. I'm going to be chatting about just a quick introduction of neuropathy. There's a lot of myths out there on what it actually is, and I'm going to go over a little bit of anatomy and physiology. I don't want to bring you back to your high school science and biology days, all of those nightmares. I want you to relive that. So some quick anatomy and physiology just to make sure we're on the same page. I'm going to talk about some stats on neuropathy and how this is actually impacting our country and the burden it's having on all our citizens. It's pretty large. And we're chatting about some mechanisms of damage. There's a ton of different factors that go into neuropathy. It's usually not just one thing we're finding that's causing the damage to the nerves. It's a bunch of different things adding up. Alright, and of course, while you're all here is some new research. There's some exciting stuff out there that not a lot of people are paying attention to. In the last 5-10 years, there's been huge advances in what we're actually learning with neuropathy, and there's too many people that are stuck in the past doing the same thing from 20 years ago, and we can do a lot more for people. Alright, last is what can we do to actually help people, and there's a lot of cool techniques out there as well. So when you break down the word neuropathy, neuro equals nerve, and pathy equals problem. Put that together, it's a nerve problem. So it's a pretty general term. It can describe any problem with any nerve in your body, but how people generally use it is a problem in the peripheral nervous system. So a problem with the nerves in your limbs, so your arms and your legs. And speaking of that peripheral nervous system, this is a breakdown of all of the different areas of your nervous system. So it's divided into your central nervous system, your brain, your spinal cord, and your peripheral nervous system, which we're going to be talking about a lot today. But I bring up the central nervous system because we are actually going to dive into a little bit of new research that how neuropathy is actually changing the brain as well, and they're definitely related. So the peripheral nervous system is divided into your motor nerves and your sensory nerves, and then you can divide your motor nerves further into nerves that you can control and nerves that you can't. So the nerves that you can't control, that's your autonomic nervous system. It's your parasympathetic system, so your rest and digest, which is actually very important. I'm going to be talking more about that today with neuropathy. And your sympathetic nervous system, your fight or flight. You need both systems, but there's unfortunately too much of our fight or flight system activated at different times of our life, and that's causing a lot of damage to our nerves. So we'll be going more into that as we go along. Alright, I'm sure all of you have experienced some of these symptoms, all of these symptoms. These are the typical signs that people experience with neuropathy. And I want to talk more about this autonomic right here, because that's your fight or flight system that's running out of control, that's causing this sweating, this redness, cold feet, the feet are turning different colors, the hands are turning different colors, as well as these skin changes. And even I find a lot of people that aren't complaining about neuropathy, even if they have dry, cold feet, that is a form of neuropathy, and they weren't even aware that they're getting less blood flow to their nerves, and that's causing some damage over time if we don't address that. Because your nerves, your arteries, and your veins, they all run together in your body. You can't separate them, and so anytime you have cold hands or feet, guaranteed those nerves aren't getting as much blood flow as they should. Alright? And this is why neuropathy is so tough to treat, is because you can just have a mild form of just one of these symptoms, maybe just a little bit of pain in a certain finger, or even just a reflex change you notice in your normal checkup with your doctor. And there's some subtle things that can present that are actually more important to the bigger process of how your nerves are working. Does that make sense? Alright. This is how we usually classify neuropathy. We can break it down into a radiculopathy, so that's a problem with a nerve root as it exits the spinal cord and goes, say, into your arm. You can have a plexopathy, and that's basically a problem with your nerve plexus. A plexus just means it's a network of nerves, just a bunch of nerves in one spot. And you have two different plexuses in your body. You have a brachial plexus, so all the nerves going into your arms, and then you have a lumbar plexus, terms we can use for neuropathy, and people get confused all the time. Is it a polyneuropathy, mononeuropathy? Do we have other things going on? So mononeuropathy is just simply damage to one nerve. We see that a lot with just physical compression of one nerve. And a polyneuropathy is two or more nerves affected or affecting two or more limbs. And we see that a lot with diabetes and a bunch of other system-wide conditions. So you can get actually very hypersensitive whenever you have pressure on a nerve or damage on a nerve. And the term for that is called allodynia right there. And it basically means that you're feeling pain for a normal stimulus that shouldn't cause any pain. This is very, very common in neuropathy. I see this a lot in my patients. And what that means is that your pain nerves are actually firing too much and they're getting too efficient. So the more you actually fire a nerve, the more efficient it becomes. Any nerve in your body. Yeah?
Do you have this on your website?
You know what? I don't, but if you guys have your email addresses written down somewhere, okay, yeah, I can give it to Sylvia and I can give you some of these slides as well. Okay, yeah, for sure. And so this is fresh off the press. Current research is called nociceptive sensitization. This is what's happening when your pain nerves become too efficient at firing. And this is a very bad thing. You don't want to get into this stage because it's much harder to treat people that are actually way more effective at firing their pain nerves. So how does that happen? So say you damaged a certain nerve in your arm. That starts to fire the pain nerves over and over and over again. And if you don't address that, it's going to become very efficient. Then that moves into firing the pain nerves in your spinal cord and further up. And so now it's not just a problem here. Now it's affecting the spinal cord and even up to the brain as well. And that's that whole feedback loop that becomes more efficient. And that can cause just a vicious cycle over and over and over again if you don't actually break it up. Okay? And so, yeah. For sure. And that's why it's so important that after any injury that you actually get rid of the inflammation right away. Otherwise, it takes much longer to treat. It's like spraining your ankle and somebody just hops on their foot for a few months. And that's very bad because you're firing that pain nerve over and over and over again. You're telling your body this is normal. We want to reinforce that pathway, so it's going to do it more and more and more, and then it's going to be a year-long event to actually heal that ankle. So we don't want to do that. So you need to get off that foot and make sure you're not firing that pain nerve. Okay, and there's a term right here, neuralgia. And basically what that means is you can assign any term or any nerve to that. Brachial neuralgia, a problem with the nerves in your arms. Trigeminal, it's a problem with the nerves in your face. Neuralgia is basically a condition where we can't find anything wrong with you, yet you're feeling a lot of pain. And this is pretty common as well. And this is where people think, oh, I don't have anywhere else to go. They're saying I'm normal, but I don't feel normal. So you definitely need to dive deeper to figure out what's going on with that. Alright, and so timing is very, very important with neuropathy. You can't let this go on too long because we have to really work to take you back to where you were compared to if this was just happening for a few weeks or a few months. So, who here has had neuropathy for a year? What about 5 years? 10 years? 15 years? Wow. Okay. So that's a long time, and that literally changes what's happening inside the body, how your systems are normally functioning, because everything has to work around that. So we'll be talking more about that in the research, what that's actually doing over the years. Alright, so if we just see something happen over a few weeks and somebody's coming in saying, I'm complaining of this, then it usually means there's something inflammatory going on. That's the body's natural response to any damage is inflammation. And you can even form inflammation inside your body for even something that you eat. That's what they're actually finding in new research too, is anytime you eat something you're sensitive to, you can actually become inflamed in your intestines. That actually affects even how your nerves are functioning too. And the resolution to inflammation is scar tissue. That can even happen with something you're eating, can form scar tissue inside your body. Alright, so weeks to months, that's more of a nutritional type thing. years. It's more hereditary. Someone says, oh, it's been happening for the last few years. So we can see some things that you get from your parents, as well as we need to ask them when they first come in, how much pressure do you actually have on these nerves for how long? All right, someone's going to respond a lot quicker if they've only had this for a couple weeks compared to 15 years. So we have to basically take time into account in how we're actually going to treat this as well. So everyone knows that you can't really heal the nerves in your brain, your spinal cord, your central nervous system. It's very, very, very limited capacity. But in your peripheral nervous system, you can actually start to repair some of the damage, which is a good thing for neuropathy. All right, and they're finding that the rates can differ quite a bit from 0.5 millimeter a day to 9 millimeters a day, depending on many different factors and your nutritional status, your even genetics as well plays a big part in that, your oxygen levels, any medications you're on, stuff like that. So the average value is about 2 centimeters a month that a peripheral nerve can actually start to grow back and heal itself. This is the basic structure of your nerves here, a peripheral nerve. You got the cell body there, that's where all the nutrients live, and that's how it becomes nourished. It sends an impulse all the way down that axon there, and you can see it has that myelin sheath, and that's the covering that actually allows your nerves to send impulses really, really quick. It's the superhighway. We can't have any damage to that, otherwise you're going to be in bad shape for neuropathy. And then it connects to the other nerves from right there. Yeah.
So if maybe that myelin sheath
Yeah.
is damaged, then what are the chances of your nerves trying to regenerate themselves and repair, like say,
Exactly. Yeah, and that's a good question, and it's
in other words, there's no hope then?
there is hope because you need to actually start to get different nutrients in your body to start to repair the myelin sheath and go from there. But it's much harder to regenerate a nerve if that myelin sheath has been damaged. I'm going to talk a little bit about that as I go over what actually happens with diabetes as well.
Okay.
And you can separate your nerves into nerves that go from, say, the skin all the way towards the spinal cord and the brain, and then you have nerves coming from the brain, the spinal cord, going all the way up to all of the muscles and organs. So you have these afferent and these efferent nerves. So you need that feedback loop constantly firing. All right, and this is what we basically focus on when we're getting people better. This is the 3 things that your nerves need to be healthy at all times. And unfortunately, a lot of other healthcare practitioners forget this, and they don't focus on all 3, but you need oxygen, you need stimulation or activation of your nerves, and you need good food, fuel, nutrition. Okay? You can't get away from this fact. This is a basic nerve theory, and you need to address all of these equally. So here's a chart. You don't have to worry about too much with the numbers and all that, but basically you look at the top. This is basically classifying your nerves from thickest and fastest to thinnest and slowest. And this is how all your nerves are actually laid out in your peripheral nervous system. So the thickest and fastest ones, they're actually finding in the research that those are the first ones to actually start to get damaged with any neuropathy. That's usually something that you can't feel. And so with any changes in temperature, say even our cold climate here, there's actually more neuropathy in our area compared to somewhere that's more mild, like Arizona. And people actually, that's why people usually go there, because their nerves literally function better in Arizona. And as you go down, the nerves start to get thinner and thinner, and then you actually don't have any myelin, that fast conduction chemical. You don't have any of that myelin in your C fibers right there. And anytime you get that burning, that deep burning, aching pain, that's when you have a lot of pressure on your thin fibers in your nerves, your C fibers, right in there. So even when, that's why we have to listen to what people are telling us. Oh, I feel burning, or I just don't feel like I have any feeling or sense of where my body parts are. That tells us what's happening with that actual nerve and how we can help that neuropathy. Okay, so these largest fibers right here, these fastest ones, they let your brain know where your body part is in your environment. So if I'm not even looking at my finger and I know that I'm bending it because of these really large fibers. And those are the first ones to get damaged, so this is where people start to get a little bit clumsy. They're starting to drop keys when they're trying to get in the door, as well as I see people in random postures. They don't even know that they're holding their arm over here like this. That's because they have damage to that nerve telling your brain, this is what my arm is doing right now. Okay? So I see this a lot even in my patients with abnormal postures. Their shoulders down like this, and they think they're standing up straight. I'll put them in front of a mirror, they're like, oh, I need to actually stand up straight like that, because that nerve is actually damaged, telling them where their body is. Alright, some stats here. There's around 3 million Canadians affected with diabetes. It's increasing by another 200,000 every single year, which is actually, that's a huge percentage of people. There's 35 million people in Canada now, or just a little bit more than that, and that's actually quite a bit of people with diabetes. Bring that up, that's because that's the number one cause of neuropathy in a system sense. So 1 in 5 people are actually living at some point with chronic pain related to neuropathy, which is actually a pretty big stat. We need to be doing more to take care of this. So 8% of people are affected by this, and it's actually a little bit more now. And this is costing $6 billion a year. So pretty big impact. It's more than heart disease, cancer, and HIV combined, the actual cost of neuropathy. So, like I said before, that's why neuropathy is so tough to treat. There's so many different causes. You have to take into account the status of your central nervous system. So, like I was explaining before, if you have that sensitivity going on where your pain nerves are becoming too efficient, that's going to affect how things are playing out with neuropathy. If you look at the status of your immune system, if you're not getting enough sleep, nutrients, your immune system is going to be squashed, or if you're under a lot of stress, that's going to make your chances of getting neuropathy or fighting your neuropathy even worse. You have to look at your metabolic system and see how your metabolism is, how your hormones are functioning. Once again, stress is related to that too. And even your digestive system, I touched on that as well. There's tons of new research showing the connection between the brain and your digestive system. And a healthy digestive system, they're actually finding, means a healthy brain. And they are very well connected, and this has a big influence on neuropathy too. Because if you're all inflamed inside in your digestive system, those inflammatory chemicals are going to go right to your nerves in your arms and your legs. And with all of these, you have to take into genetics and even what you're experiencing in your environment on a daily basis. So these are all the different ways that you can actually damage your nerves. You can have literally physical pressure on the actual nerve itself with even just what you're doing at work, how you're sitting, even watching TV in weird postures. You can actually damage your nerves that way. Or even how you're exercising too. You can see that there's a vascular component, so the health of your arteries. And this is a big one with heart disease and high cholesterol and all that. That plays a part in neuropathy. You can be exposed to chemicals and not even be aware of it, different cleaning chemicals, of different things that's even on your food, and even different things you're being exposed to at work too, or things you're using to, say, pesticides on plants or anything like that, or stuff you're using in the garden too. You can have infections. I just put one condition in there, but there's tons of other neuropathy conditions caused by infections. You can have something passed on from your parents. Well, you can be born with some neuropathy. I'm going to go over that in just a second, and systemic. And so you can see diabetes is actually a few of these categories because it actually plays a role in a few different categories. Alright, so I want to talk about mechanical pressure. And people just think you have to have like a saw cutting into your arm to get neuropathy physically. But you can actually have pressure on your nerve by doing something repetitively. Say you're even just using a screwdriver over and over and over again. You start to tighten those screws. Over time, you're going to affect this muscle right in here, and they give some sensitive nerves go right through that muscle that can actually be damaged. And I see that a lot. There's been too many carpal tunnel syndrome surgeries that have been performed when the problem was actually up here in this muscle causing damage to the nerve. So the problem wasn't actually at the wrist. Even in different postures that people are, you can see I have a hairstylist here. I have a lot of hairstylist patients. They're doing this all day. Alright, and you have a lot of sensitive nerves going right through here that can get compressed when you have your arm up here. You don't even have as much oxygen going into the arm because the blood flow isn't the same as the other arm. Alright, so they suddenly come to me and say, I have numbness and tingling in these fingers here, what's going on? Like, well, I can see what you do for a job and what you're doing all day. You're on your feet in weird postures like this. So it plays a part for sure. You can even see a checkout counter. I've seen a lot of these people who are leaning up against a counter all day. They're putting pressure basically right here near the groin. And you have a lot of nerves that go right through there, right through this ligament here. And you can actually start to compress that nerve as you put more and more pressure on it. Or even if you have a big tool belt on, I've seen this in a lot of police officers, their tool belt is actually around 20 pounds. Just hang 20 pounds right off your waist and see what happens for 5-10 years. So it definitely plays a part. Alright, so this is the typical scenario with diabetes and how it kind of starts. So you have, say, you have a lady who has a bowl of ice cream before bed every single night. Okay? She feels fine until over time that your body can't really handle that sugar load. So what happens is she has that bowl of ice cream, that sugar is circulating around in your body as she starts to sleep, and your nerves automatically suck that sugar into the actual nerve. Your muscles need insulin to actually have sugar go inside, but your nerves don't need insulin. So they just take any sugar that's going around inside your body and they just suck it right out. Okay? So all that sugar needs to go somewhere, it needs to be converted into something, and so that's where you have this chemical here, not really that important for our uses, it's called sorbitol. But what that does is it attracts tons of water into the nerve, and it starts to swell up, causing damage to the actual nerve itself, as well as damage to the blood vessels around that nerve. Remember I said that your nerves, your arteries, and your veins all are right beside each other. Okay, so any swelling of that nerve is going to damage some blood vessels. So you kind of have a multiple angle attack from this actual sugar going into the nerve. Yeah.
So does that mean even if you're not diabetic and you have this neuropathy, you're saying like try and stay as much away from sugar as possible?
Yeah, it's just
every once in a while I like that chocolate bar.
for sure.
You know, right?
We're only human, exactly. But you just need to, the sugar surges in our blood is what causes the damage, not the actual sugar. It's just a lot of sugar all at once, and then you keep doing that over and over and over again. And there is a genetic component to this. If you have the best genetics ever, where you can actually handle a ton of sugar inside your nerves and not cause any damage, you're not going to have any symptoms. But unfortunately, if you don't have the best genetics in the planet to handle that sugar, it'll take less sugar for you to be eating compared to somebody else to start to cause some damage in it. Okay? Alright, so not only is there damage from swelling, now you actually have different chemicals that are starting to be damaged inside that nerve that deal with your myelin. So remember that really fast conducting substance that causes your nerves to transmit impulses quick. Now you're not forming as much myelin. So you have a multi-angle attack here of lack of blood flow, you're not getting as much myelin to that nerve, and all that swelling. Okay, so now she wakes up in the morning after having had ice cream for 6 months, and she starts to get pain in her feet as she walks around for 15-20 minutes, then it starts to go away. And then over time it starts to last 30 minutes, 40 minutes. And after a while the pain in your feet starts to stay around all day. And this is kind of the typical scenario of what happens. And then they realize, oh, now there's actually a problem here, and I need to get this looked at. And it's been happening for a very, very long time. Alright, so chemical and toxic. So alcohol is a big one. It doesn't allow your absorption of vitamin B1, which is thiamine, and this is what we actually give to a lot of alcoholics right in the hospital is thiamine, because they're very deficient in that. And your nerves need vitamins, and they need B1 especially as well. Okay, I've also seen, unfortunately, there's a lot of medications out there that do have a lot of serious side effects, and the FDA just came out with this in 2013 that there's a bunch of antibiotics that a lot of people have been using. I've seen a lot of my patients on these that can cause neuropathy. They've linked it directly to neuropathy. So you have your Cipro, your Factive, Levaquin, Neuroxin, Avaloxin, Floxin. A bunch of random words there, but definitely have to take into account what you're taking, what you're putting in your body that could have an impact on your nerves. Okay, and like I said, you can get definitely understand the need for vaccines. It's just some of them have been linked more to certain syndromes than others. So this Guillain-Barré syndrome here causes weakness to start with your feet and start to rise all the way up to the hips, to the hands, all the way up until you almost need to be on a ventilator in a few weeks to about a month. You got to catch this very quickly as well. That's a very severe form of neuropathy. And I've seen a lot of my patients, they had an epidural when they were pregnant, and they unfortunately nipped one of the nerves in the lumbar area. Now they have a lot of numbness and tingling in their legs, and different surgical procedures that have actually caused neuropathy. Yeah?
Just in regard to the last slide.
Yeah.
The previous one. Are people that have neuropathy, peripheral neuropathy, more susceptible to these pharmaceuticals? Once you have it, does it make you more susceptible to more?
That's a good question. So whenever you have neuropathy, the blood flow isn't really working 100% to those nerves. And so medications are distributed throughout your blood. And so that medication actually isn't working 100% as intended if you have neuropathy, because it's not being distributed evenly in your body. So it's going to have a little bit of a different effect compared to somebody who doesn't have the neuropathy or the blood flow issues. So does that kind of answer your question?
Sort of. Let's just say somebody has chemical-induced neuropathy,
Yeah.
versus somebody who has diabetes.
Okay.
Well, in my experience, I came in like probably a year ago, somebody gave me watch the one film,
Okay.
and it made it much worse.
Yes.
So are the people who started off with chemical problems for the chemical neuropathy more susceptible than, say, somebody with diabetes?
Gotcha. They're more susceptible in the nerves that are already damaged. Diabetes is more of a system-wide event. So it's tough to say, to be honest. There's still, I think there needs to be more research done on what certain medications are doing to the body and how susceptible we are. Maybe it needs to be a contraindication to give somebody this drug. If they have this condition, we can't give them this drug. And so maybe we need to do more research into that. Yeah. All right. So I talked about the hereditary causes of neuropathy. And you can actually be born with something like this. And the typical profile is called Charcot-Marie-Tooth. I just took one hereditary condition. There's many, many, many others out there. And I've even had people come in that didn't even know they had something like this. And this is the kind of the typical feet and legs of what they actually look like when they come in with something like this. So they have those really high arches in their feet. The toes are starting to curl back a little bit. Those are called hammer toes. And then you have these are called champagne bottle legs. And so they're a little bit skinnier in here, and then they just have a typical shape like that. Okay, so we have to be aware of certain things like that going on too. All right, so let's get into some research here, and there's some pretty heavy concepts that I want to break down, so if you don't understand anything, just let me know, okay? What they're finding actually is that the neuropathy, and I kind of touched on this before, the neuropathy starts about 3 to 5 years before there was even a diagnosis of neuropathy, okay? So that's when you have pressure on those really thick, fast fibers in your nerves. You don't even feel that there's anything wrong, but that's sending information to the brain about where your body parts are in space, and so it's not getting that anymore. So this is starting to happen 3 to 5 years before you even feel anything at all. And they're even noticing people have altered balance. They have different cognitive issues. They're not thinking as clearly, and they're finding this happens 3 to 5 years before there's even any diagnosis. Now, the normal motion of your spine is you bend your head to the right side. All the bones in your neck should rotate to the opposite side. You bend your head to the left. All the bones in your neck should move to the opposite side again. When you bend your body to the side like this, it's a little bit different, and all the bones in your mid-back and your low back should actually bend into that. That's the same on the other side. And we see a lot of problems with people that don't have this normally working for them. They bend their head to the side. You can actually see this on x-rays and things like that. They bend their head to the side, and there's certain bones that just stay right there. They don't do any movement at all, or they even rotate to the improper side. and that can put too much pressure on your joints, that causes a lot of pressure on your nerves. So this is very, very common. There's actually a physical reason for a lot of numbness and tingling going on in your arms and your legs, because the spine isn't moving properly, and that's because of a lot of poor postures that we're in. Car accidents is very, very common. Falls, things like that. Okay, does that kind of make sense? All right, there was a research article done 2014 that actually found that blood flow in the brain is literally different in people with a disc herniation in their low back. They have a lot of pain in their low back, they have numbness and tingling in their legs, and the blood flow in the brain is different. So you have to ask yourself, why is that happening? Okay, and those nerves aren't sending as much information up to a part of the brain called the frontal lobe. Right in here, this is the prefrontal cortex. That's the area in the brain that gives you all of your human qualities, your personality, your decision making, your social aspect, all that stuff. So it's very important that this frontal lobe is working as well as it can, and neuropathy is unfortunately affecting that. So there's a lot of blood flow changes in that area, even just from something happening farther away from the brain. Alright, and this is kind of a next step into this, is they found that peripheral neuropathy actually affects what are called these HCN cells. Don't worry about that too much, it's just these cells are located in your frontal lobe, and they actually give your frontal lobe more rhythm qualities. They're a pacemaker of your frontal lobe. And peripheral neuropathy is actually affecting those cells, so now your frontal lobe isn't working as well. And this is a big area in your brain that assigns importance of pain and how much pain you actually receive and are aware of, is the frontal lobe area. They're finding that there is starting to be some damage from peripheral neuropathy in this area in the brain. You can't separate the two. The nerves in here are directly connected to the nerves in your brain, and your brain's going to tell you how much pain you're actually experiencing. So it's important that these areas are working very well. Okay? And I have over here, mind over matter. If you don't mind, it doesn't matter. It's kind of a silly saying, but it's so true. A lot of patients in my office, they've been dealing with this pain for so many years, that's all they can think about. And that's going to make their pain and suffering worse and worse and worse. Even though nothing's really changed inside of them. The more attention you pay to pain, then the worse off you're going to be. So I like to hear what people are experiencing. They should tell me what's happening, but we don't want to assign too much importance to what's going on, because it's going to only interfere with what we're doing with them. Because they keep thinking about it over and over and over again. Remember, the more you fire your nerves, the more efficient they become. Same thing even with your thoughts too. So that can definitely go against what we're trying to do with people if they constantly are just thinking about their one pain over and over and over again. Okay, another research article here in 2014, they found that pain was actually related to how different systems, all the different nerve systems in your body are working. And they're finding that even your visual system, your immune system has a big influence on how much pain you're actually experiencing. And all the sensation in your body goes to one part in your brain first. It's called the thalamus here. They used to say it was more of a relay station. All this sensation goes there and then it's fired right up to the brain. But what they're actually finding is this is more of a gatekeeper now, where it can modify certain signals that are going on in there. So all the sensations coming in right in that one area, and now it can be changed into something else. So if there's a problem in here, you can actually be experiencing way more pain than you should be, even though there's really not a whole lot going on in, say, your arm that might be causing that. And so there's new therapy here, and I'm going to be talking a little bit more about this in a few slides, but what I'm using with people is sound integrated tactile stimulation, visually integrated tactile stimulation. What we need to do is start to make this area where all your sensation goes, we need to make it start to work properly. You have too many crossed wires going in different directions right in this thalamus area here, and we need to basically start to make it work properly and get rid of that neuropathic pain. And we can do that with these two therapies here. I'll go over that in just a little bit more detail. Alright, chronic neuropathic pain actually ages the brain. They're finding that pain fibers actually start to shrink the brain over time, which is very, very bad. It can actually age you a decade or two, they're finding. So they have 5 to 11% less volume inside their brain with chronic pain. So we definitely need to get this taken care of right away. Otherwise, it's just going to get worse and worse. Because now your ability to handle the pain is even worse as you start to shrink the brain a little bit more. It's just a vicious feedback cycle. So they found the very first signs, even though we could tell you this a long time ago, there's now research proving it, that there is inflammation inside the brain with chronic pain due to neuropathic pain. And what do you know? The inflammation is right in that area I was talking about, that thalamus, that gatekeeper, the relay station, where all your sensation is going in. There's inflammation there, and therefore it's causing some crossed wires, and you're feeling more pain than you should be. Alright, so here's another cool treatment I've been doing with people, and there's tons of uses of this. It's vagus nerve stimulation. The vagus nerve is a nerve in your lower brainstem that actually causes you to have lower heart rate, lower blood pressure. It keeps your intestines healthy. It is actually been used for a lot of depression and seizures and stuff like that, as well as chronic pain. And how well this nerve is firing depends on how much pain a lot of people are actually experiencing. And years ago, you had to actually cut somebody open and electrically stimulate that nerve in your brainstem. But now, they actually found this, what this graph is showing, we can actually stimulate that part of the brainstem with a little electrode inside the ear, and that goes right to that vagus nerve. And so we can do a lot of cool things for a lot of different conditions, just stimulating that vagus nerve. Alright, so what do we usually do with people? Where do we start? We need, like I said before, neuropathy has tons of different causes. We need to do a proper history with somebody to figure out what's exactly happening, so what they've experienced in their life, and work our way backwards a little bit to figure out what's actually going on. It could be a combination of many different things causing their neuropathy, even though they just think it's diabetes, or it was just this one car accident, or something like that. But it's usually a combination of many different things. Then we do our actual neurological exam, and I do a little bit more detailed exam than a lot of people. So I look at basically every reflex in the body, I compare it side to side. I do all your sensation testing to figure out exactly what's happening. We do a lot of balance testing, and remember I talked about your autonomic system, so your fight or flight system, or your rest and digest system. How well are those systems actually working? Because that influences how much pain you're actually experiencing, and even the neuropathy too. Okay, obviously I am a chiropractor, so I do adjust the spine as well. I can't get away from the fact that a lot of neuropathy is helped quite a bit by adjusting the spine. There's tons of research on there showing that the better we get the joints moving, the less pressure you have on the nerves. Okay? Now, there's a PhD fellow by the name of Dr. Sperry who actually found out a few years ago, he actually won a Nobel Prize for this. He found that 90% of the information going up to your brain comes from the muscles and joints in your spine. So, it's very, very important that your spine is healthy and moving properly, otherwise your brain's not getting 100% information that it should. And that means it can handle pain better if all your joints are moving better as well. It's just something as simple as that. Alright, so we see that joint motion equals joint and muscle activation equals brain activation. And a lot of people just think, oh, I have back pain right here. It actually has a big consequence to your brain. Alright, and so this is basically what you need to do to handle neuropathy. You need to handle these three things. And some people are only using one of these factors to treat neuropathy. Some people maybe maximum of two, or maybe even none of these at all. But you need all three of these to help with neuropathy. So you need what's called volitional treatment. You need to use voluntary firing of that nerve. So as simple as if you have a bicep nerve that is cut, you need to start to work that bicep, start to fire that nerve over and over and over again. So that's voluntary. Then you need to use reflexogenic treatments. You need to use reflexes, something that you can't control. So say we start to use the bicep reflex to start to rehab that nerve. You can use other reflexes that are going to send direct nerve impulses to that area. So you need to use that as well. It's very effective. And then artificial treatment, which is something we add to the body. So some electrical stimulation is very effective as well as ice and heat. And there's a lot of different artificial methods that we can use too. So you need to use all three of these to get the best results possible. Okay. Does anyone know what this is here?
Football player.
trophy. So this is awarded to the most outstanding U.S. college football player each year. And the reason why I have this here is the position he's in. That's actually how your body moves around in this world and how your nerves are activated in different patterns. So you can see that he has his right leg flexed forward and then his left arm flexed forward. And this is actually how we walk. You put your right leg forward and your left arm forward, and then you alternate. And you do this over and over and over again. And it's this reflex that we can actually use to treat neuropathy to get it working properly again. Because when, say, you contract your bicep, now your tricep has to relax. Otherwise your arm wouldn't move. That's how your muscles work all over your body. And it's problems in neuropathy, that's when this doesn't work properly. So when you extend your arm, you have to contract your triceps. You have to relax your biceps. Okay, and we can use that to our advantage. So we're actually doing fast stretches to certain joints. They're actually compressing that nerve. There's too much muscle tone in, say, your bicep here. There's too much muscle tone in all these muscles in your arm here. And we need to do a quick stretch to get this to relax so that you can have more muscle tone in the back of your arm here. And it's this cross-board reflex that we can actually use to our advantage. Anytime that you actually contract your biceps, you're actually starting to activate the nerves in the back of this arm because this is how you actually walk, and we can use that to our advantage. Alright, and very effective treatment as well. They're called active nerve glides. Anyone heard of these before? So what they do is, remember I said anytime you have inflammation of a nerve, you form scar tissue. That's the one end result of any inflammation in your body. Scar tissue is actually going to hang up your nerves and allow them to basically just be stuck in place. And we need to start to break up that scar tissue and allow that nerve to glide back and forth normally. Okay? This picture on the left up here, she's doing an exercise basically to free up the median nerve. That's the nerve going right through the carpal tunnel area. And it gets caught a lot. It can even come out of the neck and not be moving properly as it goes down to your wrist. So you extend your arm like this, you bring the head over, you look, and then you start to move the hand around. That physically stretches the nerve around 2 or 3 centimeters as it exits the spinal canal, and it moves it in and out as you start to rotate the wrist around. This is very, very effective stuff because you're literally starting to break up that scar tissue, and the better that nerve can move, the less pressure it's going to have on it. And I've had somebody with sciatica for about 20 years. In the very first visit, we did some of these for the lower leg, where you actually have them on your back, the legs extended, and I start to flex the foot back and forth, and that actually moves that nerve in and out of the spinal cord about 3 or 4 centimeters. And they were able to walk around with no pain after 20 years of just doing this for a few minutes. Pretty cool stuff. Okay? And we can also use a few other things, like I said, heat or ice. And heat will increase the firing of a nerve, and ice will decrease the firing of a nerve. And so if your nerves are becoming too efficient, if they're inflamed, we don't want that. We want to use ice to start to decrease that firing of that nerve. And what they're finding is that anytime you have inflammation, you have pain. Anytime you have pain, you have inflammation. You can't separate the two. Some people think, oh, you're in the acute stage for a week. So you just use ice for a week and then you're fine, even though you have pain after the fact. But anytime you have pain, you have inflammation. So we need to use ice for that at all times. All right. And I covered this just a little bit. This is the vagal nerve stimulation. This is just a picture of what I actually do in the office. And that's the ear clip in there. And we can actually stimulate, it's called the tragus of the ear, and we put that electrode in there. It's painless. It's sub-threshold therapy, so you can't even actually feel what's going on. You might be able to hear just a little bit, but we use this for about 10-15 minutes. It has huge effects on neuropathy, on neuropathic pain, and digestive health, even depression, things like that. And I mentioned this earlier, the sits and the vits. And you can see what I'm actually doing right here. This is more of the sound integrated tactile stimulation. So she has these bone conduction headphones on, these things right here. They just go kind of right in front of your ears, and you can actually stimulate different parts of your balance system to decrease your pain. They found a certain frequency that you can do that at is very, very effective. So we pair that sound with what I'm doing. I'm going to be stroking a painful part on her back, with a non-painful part. And we're going to combine all of that to basically get all of your sensations working properly again, instead of just feeling pain over and over and over again. We need to break that cycle up. And this is actually pretty effective stuff that no one else is doing that can help with that too. Okay, now, so I talked about the sits there and the visually integrated tactile stimulation. That's where somebody's actually looking at the neuropathy, the part that's really hurting, and I'm going to be starting to stimulate that part along with a different part that's not hurting, and we can have them looking at that, and that's more using the frontal lobe to start to change some certain things there. So the frontal lobe is very, very, very powerful. They actually did a test one time. Somebody needed a knee operation and had really bad knee pain, could barely walk. They didn't do anything to him. They actually just gave him some anesthetic. He woke up. He thought he had the operation done on his knee. He started walking around as if nothing had happened. But it's actually this frontal lobe, the placebo effect is almost way greater than what we can even realize with certain people. And he thought he had the operation done and his knee was normal again and he was fine. But it's his brain telling him that something happened, something was done to that area, and we're fine again. So the brain's very, very powerful. Alright, and so I talked about some more artificial stimulation. We use what's called high volt galvanic stimulation. Sounds scary with the high volt, but this is sub-threshold stuff, so you can't actually really feel what's going on. But this uses the exact same current that your nerves use to send impulses to the brain. So this is the most effective. A lot of people use tens units or microcurrent or any other different devices out there, but this is the most effective because it uses the same current that your nerves use to get healthier.
Can that stimulation be used if you have a pacemaker?
No, we have to be careful with that. Yeah, good question. So we'll have to do something a little bit different, different form of treatment for somebody with a pacemaker. Yeah.
How about anybody that might have a metal plate? Would that work? If there's
Basically, same thing.
It's not going to...
We have to be careful with that stuff. We definitely can't do it over the area, but it depends on what's going on.
But if it's in a different area of the body than the one that's affected, where you have the neuropathy.
Right.
Okay, but let's say it's in your arm, but the neuropathy is feeling over it.
I still would stay away from it, personally, but we have to do it a case-by-case basis. Yeah. All right. So I've kind of not been mentioning diet in all this, but it is also very, very important. Remember the three things your nerves need: oxygen, stimulation, and diet. Okay, so they need nutrition. And what they're finding here is if you're in a lot of pain, you need to actually eat less. The less you eat, I'm not saying starve yourself, but if you eat a little bit less calories, you're going to be experiencing less pain. Your body has less of the fuel to actually start fueling this fire over and over and over again. And what they're finding is certain things that you're eating are actually starting to break down into all these inflammatory chemicals here. So the things you're eating, like the red meat, the egg yolks, yes, they are healthy, but they also break down into these inflammatory pain-causing chemicals. Okay? So if you eat less of these, you're going to have literally less of these inflammatory pain-causing chemicals. And this is what aspirin and Tylenol and all those things do. They actually inhibit these chemicals that are up here. The COX-2, COX-1, prostaglandins, all that stuff. They actually inhibit that from forming. But you can do a lot of this by not taking the drugs, by changing your diet a bit. Okay, salt. This is a big one with your nerves because you have, anyone heard of the sodium potassium pumps? I know it's been a while from the science days, all that stuff. But this is how your nerves fire. As you start to fire a nerve, all that sodium rushes into the nerve, and then once it's done firing, it needs to pump it back out. And the more salt you have floating around in your blood, the higher this spike is going to be right in here, that action potential. So you fire that nerve, you have a ton of salt in your blood, now that spike is going to be way larger than before. It's literally going to take more time for this spike to come back down and for that nerve to go to rest again, and you be able to fire that nerve. So you're physically not able to fire your nerves as quickly if you have a lot of salt in your blood. And they hide a lot of salt in everything these days, and so you just kind of have to be a little bit conscious of that. Okay? Alright, now, your body works way better in a more basic environment, a more alkaline environment. So anything above a pH of 7. Our blood is normally about 7.35, 7.45 on the pH scale. It's a little bit more basic, but a lot of us are starting to do things that cause this to shift more towards the acidic part of the spectrum. And so all your cell machinery works way more efficiently in a more basic environment. And the foods that we eat can actually impact that. So the more basic foods are the, as you know, these are healthy, the asparagus, the kale, some certain nuts and things like that. And so we need to steer clear of different things going on that might cause some more acidity in our blood, making that neuropathy worse. All right. Now, this is pretty simple stuff that a lot of you can do. This is pretty simple stuff a lot of you can do that actually has a huge, huge impact. I've had somebody who had numbness and tingling in these fingers here, in ring and pinky, for 5 years. All I did was this right off the bat, get more oxygen into the system, these breathing exercises, and it was gone in less than half a day. Okay, so like I said, your nerves need oxygen, stimulation, good food. Oxygen is a big part. You think, well, I'm getting enough oxygen in, I'm breathing normally throughout the day, but a lot of us are just breathing shallowly. We're getting only oxygen into the top parts of our lungs. We're not actually getting oxygen into the deep parts of our lungs where most of the transformation takes place from oxygen to carbon dioxide. Okay, so I usually tell people breathe in through their nose for 3 seconds, out through their mouth for 5 seconds. You can do that for about 5 minutes every hour, and you're going to notice the pain's going to be much worse, or not much worse, much better. We don't want that much better, as well as you're going to have clearer thinking, and you're going to have better movement of your limbs as well. Okay, so it's really big. And also, here's this Herring-Brewer reflex. Anytime that you take a deep breath in, you literally fire the nerves in your lungs to tell the brain to decrease your pulse and your blood pressure, decrease that stress response. And so now you're not as stressed. Now you're actually getting more oxygen to the distal parts, these really far away parts from the spinal cord that didn't have as much oxygen before. You're also starting to change the size of your blood vessels so that now they're not all puffed up when they're really stressed. Now you're starting to get them to calm down. There's more room for your nerves to actually sit in place and function properly. So it's pretty cool stuff. You have another reflex that you're born with called the oculocardiac reflex. You ever seen anyone who's really stressed? They're rubbing their eyes like this. They're subconsciously trying to decrease their stress by lowering their heart rate and their blood pressure. Anytime you rub your eyes, you actually fire off nerves that go to the brain to tell it that you're too stressed. We need to lower the heart rate and the blood pressure. Therefore, you're starting to shrink your blood vessels a little bit more in certain parts in the faraway areas. Now they actually have more oxygen. Lower the blood pressure and the heart rate. And these are all built-in reflexes we can actually use to our advantage. Okay, and like I said before, the more you fire certain nerves, or any nerve, the more efficient it becomes. You can actually start to create a longer-lasting pattern with all these reflexes here. All right, and meditation, they're finding in the research, is huge for pain, for depression, for a clear mind. There was a Harvard study done in, I think about a year ago, that they actually found people can cut their pain in half, but just by doing around 10-15 minutes of meditation every night. And that's working more on that frontal lobe again. You're calming that stress response down. So big impacts there. All right, now mirror box therapy. I use this a little bit with, more so with stroke patients, but we can have some really big results with neuropathy too. You actually put the bad extremity, the arm, say the left arm is bad in this case, inside this box here. Now we're going to start to move that right arm around, and we have them actually look in the mirror, and they can actually see that left arm moving around, even though it's not really, it's inside the box. They can see what looks like their left arm moving in that mirror. It's moving pain-free, it's moving with a lot of strength, and they can literally feel the blood start to return back to their hand. It's pretty cool stuff. And this is using more of that frontal lobe again, of seeing what's actually going on and experiencing what's actually happening in that limb. So you do some cool stuff with using that frontal lobe and using some mirrors and things like that. Okay, now posture, it's kind of a boring topic. A lot of people just sit up straight. Your mother's been telling you that for years. But it has big consequences. If you try to take a deep breath when you're hunched over like this, You can't. If you stand up straight, you take a deep breath, you can get way more oxygen inside your body. And like I said, in neuropathy, you need more oxygen. Okay? Not to mention, we were talking about that cross-cord reflex. You contract your bicep, you have to relax your tricep. Same thing happens with every muscle in your body. So if you're sitting like this, you're constantly contracting all of these muscles right here. They get really tight throughout the day, even these muscles in this arm. They turn off certain muscles in the back. And that's when you can start to cause too much damage to those joints and those nerves in your back as they start to chronically tighten. Okay? So we do this is called doorway exercise. There's lots of different stuff that we do with people that they can actually start to open up their core. So they would get them basically from this. They're sitting on the computer all day, and we start to stretch open these really, really tight muscles. They can take a larger deep breath in, and it helps a lot with neuropathy. All right, now exercise is a big one. Everyone thinks exercise is good, but we don't understand how beneficial exercise really is. Anytime you start to move around a lot, you're firing those really big, those thick, fast nerves all the time, constantly sending great information to the brain. And the more of that happens, the healthier the brain is going to be. And like I have right here, athletes have a higher pain tolerance, a higher pain threshold than somebody that doesn't exercise. So they can actually handle more pain because that frontal lobe is literally healthier. It can inhibit more pain that's coming in. Not to mention exercise helps with sugar control, with diabetes and insulin release. It actually regulates all that and basically puts it back on track. Okay? Not to mention you feel more calm after exercise, you're less stressed, and that helps a ton with what's going on with the nerves out to your extremities. And I just read a recent research article on this, and they actually found that walking is as effective as running or jogging. So you just need to walk a little bit longer than the actual run, but the same benefits are found in the heart and the lungs and all that. So at least if anything, just try to get out for a walk. All right, so the big message here is that there is hope. All right, there's too many times people say, oh, this is what you have, nothing we can do about it. And there's always something we can do for people. All right, and we may not cure something that's been going on for way too many years, but we can actually improve your quality of life, your function, and give you your life back. That's what a lot of people want. So there's new research in epigenetics, and they're finding that you're actually not a slave to your genes. That's why I have genes here. All right. What they're finding is your environment is actually very, very important, and your genes can actually shape and change as you start to age. Yes?
On the walk,
Yeah.
and you have neuropathy at the bottom of your feet, and you're inflicting pain every time you
Exactly.
walk. So
Yeah.
is that making it worse because you're firing up the nerves?
It would be, so you need to do something else that will not cause that fire or that pain. So you need to do something even with your upper body, and that's sending a lot of good information to the brain, or a different form of something for your legs, like riding a bike that might not be firing the pain as much, or something else like that, or even swimming. Swimming is huge. It's less impact on the joints, which is great for arthritis, and you're basically taking the stress off of your system. You're taking gravity out of the equation a little bit because you're more buoyant, and so now it gives your brain a chance to relax. It's not firing as much due to gravity. Okay?
What about exercise?
Yeah, that's also good too. Like he pointed out, if you're in too much pain, then definitely stop because you don't want to make things worse and more chronic. Yeah, but judge how you feel with certain activities and go from there. Okay, and what they're finding is it's a 60 to 40% rule. All of us are born with the exact same 60% of all the same nerve pathways in our body. And that leaves another 40% to actually be changed by our experiences and also what we're doing in our environment. So it's actually a big percentage there. We can make some big changes in our own bodies. You just don't have to say, oh, my parents had this, so I'm going to have it, and that's the end of that. You can actually take control of what's going on. Okay? And thank you very much. Are there any questions?